practitioner student from the University of Texas at Arlington, and I'm going to be caring for you today. Okay, I'm going to do a head-to-toe assessment. Okay, first I'm going to wash my hands. Okay, let's go ahead and get started. All right, so first, tell me a little bit about yourself. Tell me your name.
Blake.
Okay, and where are you right now, Blake?
I'm at your house.
Okay, and what's today's date?
August 3rd, 2016.
Okay, how would you describe your mood right now?
Good mood.
Okay. All right, so Blake is an adult male. Okay, he is oriented to person, place, and time. His speech is clear, and he says that he's in a good mood, which is appropriate and is congruent for his affect. Okay, his appearance is appropriate for the season and for the setting. All right, Blake. First, I'm just going to inspect your hair. Okay, take a look. Okay, the terminal hairs are evenly distributed throughout the scalp. I don't note any infestations or lesions throughout. Okay, now I'm just going to kind of palpate throughout here. Do you feel any tenderness or pain whenever I palpate your scalp?
No.
Okay, so no tenderness, no nodules, no masses, no infestations noted. All right, so further inspection. Let's see. All right, so your head is midline. It's normocephalic. Okay, I don't know any ticks or tremors to Blake. Facial features appear to be symmetrical. Okay, eyebrows are evenly distributed over each eye. Eyelashes appear to be evenly distributed above each eye. Let's see. Go ahead and just look a little bit closer. Okay, sclera is white. Okay, conjunctiva is clear. Okay. All right. Now I am going to go ahead and lay my hands on your eyes. Can you close your eyes for me? Okay. Do you know any pain whenever I palpate your eyes?
No.
Okay. I don't feel any lesions, any bumps, any masses, or anything like that. Okay. Eyeballs appear to be firm and intact. There's no erythema, no drainage noted to the lacrimal areas. All right, no exudate noted. Okay, so one really common eye test that we normally do is called the Snellen test. And we generally have you stand directly in front of a Snellen chart, about 20 feet away. We have you cover one eye, and then we have you read the smallest line possible. Then we have you uncover that eye, cover the opposite eye, and have you read the smallest line possible, and then we have you uncover both eyes. Whether you wear glasses or you don't wear glasses, we have you wear your glasses, take off your glasses, do both, and then we give you a reading on your visual acuity. And that's a distance visual acuity. Today, however, since we're in closer quarters, we're going to have you do the Rosenbaum chart. Okay, so what we do with this is we have you hold out your arm 14 inches. So I'm going to measure from your eye to the chart. So kind of hold that out. Let's see, I'll measure here. Your eye. Okay, so in just a hair, about right here. My finger's up, perfect. Okay, and this is going to be a near central visual acuity. Okay, so I'll hold this for you. Okay, now go ahead and cover up your right eye. Okay, now read the lowest or the smallest line that you can see possible.
428,739.
428,739. Okay. And now
28739.
Okay. So your vision is 20/20. I'm just going to check to make sure we're still rolling here. And we are. Okay, good deal. Okay. So on the Rosenbaum chart, your vision is 20/20. Okay. Now we're going to do the corneal light reflex. So I'm going to hold the pen light on the bridge of your nose. Okay. I'm going to have you look at my nose. Okay, and both pupils do constrict. All right. It shines evenly in both eyes. Okay, now I'm going to check for accommodation. So I'm going to have you look at my pen light and follow it as I bring it closer to you, okay? All right, the pupils do accommodate and constrict as the pen light gets closer. Okay. Now I'm going to have you do that cover and the uncover test. Okay, so just look at a point in the distance. Okay, I'm going to have you cover one eye. So look at a point in the distance and cover up your right eye, okay? Okay, so now uncover it. Uncover your eye. Okay, no nystagmus noted. Keep looking at that point. Now cover your left eye. Now uncover your eye. No nystagmus noted. Okay. All right. Now I'm going to do your or test EOMs, which is the 6 cardinal fields. So I'm going to have you look straight ahead, and then don't move your head, only move your eyes, okay? And I want you to follow my pen light. Okay? Just with your eyes. Okay, so the patient successfully has done all 6 cardinal fields. All right. Okay, next, you're going to do direct and consensual eye testing. Okay, so again, I'm going to have you look at a point on the wall. Now I'm going to shine a light in your right eye. Okay, at the same time, you should also demonstrate constriction of the left pupil. Okay, now continue focusing on that point in the distance, and same thing. I'm going to shine a light in your left eye, and then your pupil in your right eye will also constrict. Okay, so that is perfect. Now I am going to grab the ophthalmoscope. Okay. And this is just going to take a look through your eye, okay? Step closer. Okay. So what I'm going to do is I'm going to shine a light. I'm going to look at your right eye. I'm going to use my right eye to look at your eye, okay? I'm going to look through until I get the red light reflex. Okay. Once I got that, I'm going to move closer towards you. Okay, I am going to get pretty close until I can see the optic disc. Okay, it is clearly defined. Okay, there's no blur to it, and there's no hemorrhages noted, anything of that nature. Okay. All right. Now I am going to go ahead and do the same thing with the left eye. Okay, so I'm going to look at your left eye with my left eye until I get the red light reflex. Okay. It is clearly defined. It's not blurred. There's no hemorrhages noted in the blood vessels, anything of that nature. So good. Okay. Next, let's see. Okay. That's it on the eyes. So on the ears, let's see. Take a look at your ears. Let me turn this off real quick. Okay. So ears do appear to be symmetrical. Okay. There's no lesions, no drainage noted, no redness, no swelling that I can tell from the outer portion. Make sure this is still working. Sorry, that's distracting. Okay. Looks like, is there a piercing on each ear? No piercing. No piercings on either ear. Okay. Let's see. Take a look at the otoscope. Okay. Just going to kind of focus from afar. Okay, so I'm going to pull the pinna up and back. I'm going to kind of rest. Put thumb on there. Okay, now in the ear I don't notice any redness. Okay, so no erythema, no drainage. The tympanic membrane is visible, pearly gray. The light reflex is about 05 o'clock. Okay, now I'm going to take a look at the left ear. All right. I'm going to pull the pinna up and back. I'm going to anchor my hand. I don't notice any erythema, any drainage. Tympanic membrane is intact. And the cone of light is about 7 o'clock. Did you have any pain whenever I looked in your ears at all? Okay, so next what I'm going to do is something called a whisper test. Now I am going to go ahead and stand behind you. Okay, I'm going to say a word to you while you close one ear, and then I'm going to have you repeat it back to me, okay? Okay, so go ahead and cover your left ear.
Pickles.
Okay, very good. I'm going to have you cover that one. Come back here.
Cheese.
Okay, very good. All right, so next I'm going to do what's called the runny test, and that is where I'm going to test air versus bone connection in the ears. So I'm going to get my stopwatch out. Okay, so I'm going to make my tuning fork vibrate and set it on your mastoid process. Okay, I'm going to have you tell me whenever you stop hearing it on the mastoid process, and then whenever you stop hearing it in the air. Okay? When you stop hearing it. 2 to 1. Reset my stopwatch. Okay. So again, that was a 2 to 1, 2 being ear conduction, 1 being bone conduction, which is said to be normal. So next, I'm going to do the Weaver test, which I'm going to put my tuning fork at the top of your head, and you're going to tell me whether you hear it more in the left ear, the right ear, or both ears equally, okay?
Both ears.
Both ears? Okay, that's good. All right. So next, I'm going to take a look at your nose. Okay, so your nose does appear to be symmetrical. I don't notice any nasal drainage, postnasal drip, anything of that nature. All right, I'm going to palpate. Okay, does that cause tenderness? Does that hurt at all? Okay. Next, I'm going to take a look in your nose with a fresh nasal speculum. Okay, also I'm going to have you occlude left ear and then just breathe. Okay, now occlude your opposite ear and breathe. Okay. Any difficulty breathing on? Okay, so your nostrils are patent. Just take a look in your nose. Okay. Nasal mucosa is pink and moist. No lumps or lesions, anything of that nature noted. Okay, same thing with this one. Nasal mucosa is moist and pink. No bumps, drainage, lesions, anything of that nature. Okay. Let's see. Now I'm going to assess your sinuses. So, okay, let me know. Do you feel any pain here?
No.
Okay. Anything here?
No.
Okay. Next, I am going to assess your maxillary sinus with transillumination. So what we're going to do is, with the lights kind of dimmed, which they are kind of dimmed already, I'm going to go ahead and take a look. I'm going to have you tilt your head back, open up your mouth, and then shine a light in your right eye. Okay, open up a little bit. Okay, and I do notice the red patch inside your mouth, which means that you have your maxillary sinuses. There's air in them, and that's good. They're not occluded. Okay. And then same thing. I do notice the red glimmer of light. So your maxillary sinuses are patent. Okay, so your lips. So take a look, inspect them. They are symmetrical. Okay, I don't notice any lesions or bumps or anything of that nature. Okay, I'm just going to go ahead and take a look in your mouth. Open both for me. Okay, your tongue is pink and moist. Okay, your buccal mucosa is pink and moist, no lesions noted. Okay, lift up your tongue for me. Okay, frenulum is intact, no lesions noted. Okay, stick out your tongue. Okay, again, and then your teeth. Let's see, I'm gonna count. Okay, 1, 2, 3, 4, 5, 6, 7. Okay, you got 32 pearly white teeth. I don't notice any dental caries, any dental abscesses, missing secondary teeth, anything of that nature, any chips. Okay. Now stick out your tongue and say, ah. Okay. Have you had tonsillectomy? Okay. I don't know any tonsils, no swelling, no exudate, and your pharynx is pink and moist. Okay. Very good. Let's see. On to your lymph nodes. Okay, so I'm going to go ahead and palpate your lymph nodes, okay? First, starting at your occipital, okay? Back of the head. And your three auricular. So in front of your ears, okay? The post-auricular, behind your ears. Okay, going down to the tonsillar. Okay, the submandibular. Submental. Okay. And your posterior cervical chain, the back of your neck. Okay, and the anterior cervical chain. Okay. Alright. Now, I'm going to have you shrug your shoulders. I'm going to unbutton this shirt. Okay, shrug your shoulders. Okay. Supraclavicular. Okay, can we take your shirt off real quick? So you go ahead and do your axillary. So we normally do this with gloves, and I'm just going to palpate your underarms. Epitrochlear. Okay, the bends under arms. So did any of that feel tender? Were you ticklish? I apologize. Okay. All right, so there's no palpable lymph nodes noted, no tenderness upon palpation per the patient. So we're going to go ahead and move on to the neck. Go ahead and inspect. I don't notice any thyromegaly. I don't feel any lesions or masses. Okay. I don't notice any venous distension at all. Okay. Trach does appear midline. I'm going to palpate the carotid pulse. Okay. Okay, so carotid pulses are 3+. They're easily palpable. Next, I am going to assess your thyroid. I do not have water with me. I'll grab some real quick. I'll be right back. We're going to do this is I'm going to have you take a sip of water. Take a sip and I'm going to have you hold it until I tell you to swallow, okay? So tilt your head downward and to the right. Okay, swallow. Okay, next I'm going to have you take another sip of water. Head down to the left. So I do feel the thyroid cartilage rise whenever the patient swallows, which that is normal. I don't feel any masses, lesions, anything of that nature. Okay, so I am going to take a listen with my bell over the carotids to listen for bruise. Okay. symmetrical. I don't notice any lesions, rash, anything of that nature. Breathing appears even and labored. I'm going to go ahead and count your respirations for 1 full minute, so just breathe normally for me. So your respirations were 16 per minute, even and unlabored. Also, I'm looking at your AP versus transverse ratio, and the AP is 1, transverse is 2. Now I'm going to go ahead and percuss your lung fields. Take a listen to those. So, and then arms a little bit. So I hear resonance throughout the anterior portion of all lung fields per percussion. Okay. Posterior lung fields. Over here real quick. So again, for all lung fields, I know resonance, which is supposed to be heard over lung fields, which is normal. So next, I'm going to take a listen to the lung fields with auscultation. Okay. So next, I'm going to auscultate with the diaphragm of my stethoscope. Deep breath. So let me start over with the trachea. Okay, so I do know bronchial sounds over the trachea. Expiration equal to or expiration greater than inspiration. Okay, note broncho-vesicular in the bronchial region. Okay, expiration equal to inspiration. Okay, in the periphery as already auscultated, I note vesicular breath sounds. Okay, inspiration equals expiration. I'm going to listen a little further in the periphery. There you go. Posterior lung sound. So all posterior breath sounds are clear upon auscultation. All right, next I'm going to check for tactile affirmatives. Okay, so I'm going to use my ulnar side of my hands, just me, and then I'm going to place them on your chest and have you say 99. Okay, so say 99.
99.
And each time I move my hands, repeat 99.
99. 99. 99. 99. 99.
Okay. Now,
99.
and now the back side, do the same thing. Okay.
99. 99.
So good. I don't note any vibrations whenever you say 99 or anything of that nature. Okay, so again, I'm going to inspect your chest. I don't notice any heaves. You appear symmetrical. No lifts noted. So next, I'm going to palpate the precordium. So I'm going to just put my hand right here. No thrills noted. Okay, so next I'm going to auscultate your heart sounds with my diaphragm first to listen for high pitch sound, okay? So first, I'm listening the aortic at the second intercostal space, right sternal border. Okay, next is the pulmonic. This is the second intercostal space, left sternal border. fourth intercostal space, left sternal border. Okay, S2 equals S1. And then the mitral, which is the fifth intercostal space, mid-clavicular line. Okay. This is also where you can find your apical pulse. And S1 or S2 is greater than S1. Okay. Here I'm going to listen for a full minute. Get your heart rate. Use my stopwatch. Breaths or 86 beats per minute on auscultation in the apical region. All right, so next I'm going to listen with my bell for low pitch sounds, low pitch heart sounds. Okay. So aortic, this is the second intercostal space, right sternal border. Pulmonic is second intercostal space, left sternal border. Okay, Erb's point, third intercostal space, left sternal border. Tricuspid is fourth intercostal space, left sternal border. Mitral is fifth intercostal space, mid-clavicular. I don't know any gallops, any splitting, anything of that nature on auscultation with the bell, my stethoscope. Okay. So next I'm going to palpate your blood vessels. Okay. So I'm going to do your temporal. Okay. Next I'm going to do your brachial. Your radial. Let me take off socks real quick. Do your feet. Okay, next I'm going to do the dorsalis pedis. Okay, and next the posterior tibial. Posterior tibialis. Okay, so all pulses are 3+ bilaterally. Okay, so while I was looking at all of your pulses from the periphery, skin is even, no rashes, no lesions noted, anything of that nature. Okay, so next we are going on to nails. Okay, while looking at the periphery, notice the nails. Nails are well groomed, they're short. I don't notice any lesions, any avulsed nail tissue. Do you notice that cap refill is less than 2 seconds? Okay, upon palpation of cap refill, go ahead and do this with each of your nails one at a time. I don't notice any clubbing. Okay. Do that with your thumbs also. Good. Okay, I don't notice any clubbing. Your nail angles appear to be approximately 160 degrees. Do you get any pain when I palpate or anything on your nails? Okay. Let me look at your toenails real quick too. Good. Cap refill less than 2 seconds. All right. Skin turgor. Instant recoil. Noted. All right. Now, we'll go ahead and move on to the abdomen. Okay. So if you can lie flat for me. Okay. All right. So now we look at the abdomen. So get down to that level. Abdomen appears symmetrical, appears flat. I don't notice any masses, hernias, anything of that nature. Okay. I'm first going to listen. Oh, and most importantly, no pulsations noted. No significant vein patterns, venous patterns, anything of that nature. So first I'm going to auscultate. Good. So bowel sounds are active in all 4 quadrants. Next I'm going to lightly palpate. Okay, so let me know if you feel any discomfort whenever I do this, okay? Anything when I push? Okay, now I'm going to do some deep palpation. Let me know if you feel any discomfort whenever I push. Anything? Okay. Next I'm going to normally, take it back, normally I would percuss before I palpate. I got ahead of myself on that, but so if I could backtrack, I would have auscultated and percussed. I'm going to percuss all 4 quadrants. Okay. Listening, and I do hear tympani in all 4 quadrants. Okay, next I'm going to listen, percuss for the liver border. Okay. So, listen for changes from tympani to dullness. Okay, so I'm going to mark where I hear the change. Okay. Okay, I'm going to go ahead and mark. Okay, and I do note about 7 centimeters outlines the liver border, which is normal because 6 centimeters to 12 centimeters is the normal outline of the liver. And next I'm going to percuss for the spleen. Okay. hear the splenic dullness from intercostal 6 through 10. Okay, so now I'm going to backtrack and do the light palpation. Okay, we did earlier, so relax your stomach all the way. Okay, and you said no tenderness with light palpation, none with deep palpation. Okay, so next I'm going to do Murphy's sign, which this is just going to check for any gallbladder inflammation, liver inflammation, anything of that nature. So I'm just going to hook my left thumb at your right costal margin. Take a deep breath in. Let out a little bit. Take a deep breath in. Do you have any discomfort or anything? Okay. So negative Murphy sign. All right. So go ahead and stand for me. Okay. I'm just going to inspect your posture. Okay, so you're standing erect, nice and symmetrical. Okay, so next I'm going to have you place feet together. Okay, and arms out to your side. Okay, close your eyes. All right, and I'm going to set my stopwatch for, and then let your arms fall. I'm going to set my stopwatch for a full minute, okay? Arms fall to your side. Okay. And I'm going to be here close just in case you become off balance, feel like you're going to fall, anything of that nature. So let me know if you feel that way at all. You need to keep your eyes closed this whole minute. Do you feel like you're going to lose your balance at all? Okay. So now I'm going to watch you assess your gait. So if you'll just walk towards the table and then back to me. Good. So you have a steady gait noted, nice and symmetrical. And back to the Romberg test. That was to assess for sensory ataxia with your eyes closed, but you did beautifully. You have a negative test for that, so you didn't have any issues standing up with your eyes closed, okay? You do your steady gait noted. Now if you'll just turn facing away from me, okay? And bend over, touching your toes. Get down your level, so I don't see any rib humps, anything of that nature. Okay. Your spine does appear straight. Now go ahead and stand up for me. I'm just going to palpate your spine on the way up. Don't notice any curvature, anything of that nature, lesions. So you do have a negative scoliosis screen. Okay. So let's go ahead and have you sit. And I'm just going to percuss your costovertebral angle, okay, with a indirect fist percussion. Okay. So just let me know if you feel any pain when I do that. Any pain when I do that? Okay. All right, so no CVA tenderness. All right, so Blake, you can go ahead and put your shirt back on at this time. You're doing fantastic. We're getting close. Okay, so next, I'm just going to check your range of motion, okay? So first we're gonna do active, and where you will do it on your own, and then next with passive whenever I will help you. Okay. So first we're gonna check cervical spine range of motion. So if you can first flex your neck, so chin to chest. Okay, now extend your neck. Okay, now hyperextend all the way back. Okay, now neck back to neutral position. Rotate your neck right, and rotate it left, and then we're going to laterally rotate it right and left. Okay. So next we're going to do passive range of motion. So I'm going to help you with this. So we're going to flex, and then we are going to extend. Okay, and then hyperextend. Okay, now we're going to rotate left, and then right, and then side to side. Okay, so you exhibit full active and passive range of motion. Okay, to your cervical spine. So next we're going to do your shoulders. Okay, so first I'm going to have you flex your shoulders. So bring your shoulders straight up. Perfect. Back down. Now to the side, all the way up, abduction, all the way down, abduction. Good job. And then shoulders up like this, and then abduction, abduction. Okay. Now I'm going to help you. So shoulders all the way flexed, and then down. Okay. And then out to the side and up for abduction, and then adduction, and then onto the side like this. So abduction, adduction. Good. So you have successfully demonstrated active and passive full range of motion to your shoulders. Okay. Next, we're going to do elbows. Okay. So flexion. Okay. And then extension. Okay. Next, rotating inward and outward. Okay. Okay. Now I'm going to help you with that. Okay, so flexion, extension, okay, and rotation inward and outward, good. So you've successfully demonstrated both active and passive range of motion to your elbows. Okay, next we're going to do fingers. Okay, so I want you to flex your fingers and then extend. Okay, now adduct, straight and bring them together, and then abduct, straight and front apart. Okay, so now I'm going to help you do that. So fist, so flexion, extension, adduct, straight and together, adduct, and then adduct apart. Okay, good. So you have successful active and passive range of motion for fingers. Okay, next we're going to do hips. So I want you to lie back. Okay. So right flexion of your hip. So flex your hip like this. You're just going to bring it towards you, right one. Okay. And extend. Okay. Left one. Flex and extend. Okay. Now flex again your right hip. Okay. And then I want you to bring your right knee inward. Okay. And then so for internal rotation, and then outward for external rotation, same thing. Left. Internal rotation, external rotation. Now for abduction, I want you to rotate this leg straight all the way to the side. And then for proper adduction, I want you to slide this leg over and then bring this leg in for adduction. Okay. So same thing with this one. So flex your leg, internally rotate it, externally rotate it, flex it, internally rotate, externally rotate, and then abduction, leg straight, bilateral hips. Okay, you can sit forward. Okay, so next, the knees. Okay, so, okay, you can actually lay back for the knees also. So you can put your feet on the table. Okay, so that is going to be flexing the knees. Now can you straighten out your knees? Like lift. Okay, that's good. Lift both off the table. Very good. Okay, so then I'm going to help you with passive. And then extend. Okay. Flex and extend. Okay. Okay, so you have shown active and passive range of motion to both knees. While we're here in this position, we're also going to do the anterior drawer test, okay? So we're going to test laxity of the anterior cruciate ligament. So with your knees bent like they are, feet on the table, I'm just going to press with my thumbs to your cruciate ligament. Okay. And then do it back. Okay. Same thing with this knee. Okay. Did that hurt at all? Okay. So your cruciate ligament does appear to be intact. Okay. Now ankles. Come and sit up. Okay. So there's lots to do with this one. So plantar flexion. Toes pointed downward. Okay. Dorsiflexion. Okay. Internal rotation. External rotation. Abduction. Rotate inward. And adduction. Okay. Beautiful. So now we're going to do it. So plantar flexion. Dorsiflexion. Internal rotate. External rotate. Abduction. Adduction. Very good. So you successfully demonstrated active and passive range of motion to the ankle bilaterally. Next, we're going to do deep tendon reflexes. Okay. So the first, we're going to do triceps. So I just want your arm to relax as possible. And all right. So next, I'm going to cradle. Check your bicep. I'm going to cradle this. And our bicep. Okay, brachioradialis. All right. Patellar. Sorry, the giggles. Okay. And Achilles. Achilles is. Okay. Next, sorry. Plantar. Okay, so your deep tendon reflexes work 2+, bilaterally in all areas. cranial nerves, the optic nerve is intact, as evidenced by the Rosenbaum chart with visual acuity of 2020. Trigeminal and optic nerve is sensory, test sensory. The and optic nerve is cranial nerve 2. Sensory is intact, as evidenced by Rosenbaum 2020 chart. Okay, cranial nerve 5 is the trigeminal. This one is sensory and motor. And if you can, go ahead and clench your teeth for me real quick. Clench them. Okay, good. I don't feel any crepitus noted. Okay. Real quick, I do want to orient you to a few sensations. So one is going to be dull. Close your eyes real quick. Okay, so this is going to be dull. Okay, this is going to be soft. And this is going to be sharp. Okay, so you go ahead and do these in a few different places. Just let me know if it's soft, dull, or sharp.
Soft.
Okay.
Sharp.
Okay.
Dull.
Okay.
Dull.
Okay. Very good. So cranial nerve 5 is intact. Okay. Cranial nerve 7 is the facial. It's sensory and it's motor. Can you go ahead and raise your eyebrows for me? Squeeze your eyes totally shut. Smile. How about your cheeks? Can you whistle for me? Okay. And do you ever have any issues distinguishing between salty and sweet foods? Okay. So cranial nerve 7, facial, is intact. Okay. Cranial nerve 8 is the acoustic, which is sensory, is intact, as evidenced by you being able to repeat pickle and cheese during the whisper test. Okay. Cranial nerve 9 and 10. Cranial nerve 9 is the glossopharyngeal. Cranial nerve 10 is the vagus. Sensory and motor intact, as evidenced by your uvula rising and falling with phonation. No difficulty swallowing on the thyroid test, or no hoarseness in your voice. And do you have any difficulty distinguishing between bitter and sour foods? Okay, so cranial nerve 9 and 10 is in fact intact. Cranial nerve 11, spinal accessory. So this one is a motor. And I'm going to test your trapezius and sternocleidomastoid muscles. So I'm going to put my hand on your cheek and just turn against it. Turn towards. Good. Okay. Push against me. Push against me. Okay, so you have strong contraction in trapezius and sternocleidomastoid muscles. So cranial nerve 11 is intact. Cranial nerve 12 is the hypoglossal. So I'm going to have you do a lot of funny movements with your tongue, okay? It is a motor test. So can you stick out your tongue? Do it in and out. Okay, side to side. Touch your nose. Touch your chin. Okay. Also, can you poke it in your cheek? Okay. And then poke the other cheek. Okay. Cranial 12, hypoglossal is intact. Okay, what else do we have? Should be getting close. Okay. Let me see here. So coordination. Is it okay? I'm gonna do a few tests to check for your coordination. So put your hands on your knees and then alternate with your palms up, down, up, down. Close your eyes while doing it. Okay, up, down, up, down. So do a little faster. Can you do a little faster than that? Okay. So patient successfully alternates hands with eyes closed while progressively speeding up alternations. patient successfully alternates touching finger to nose at increasing speeds. Okay, we're going to do sensation next. So again, those three sensations, dull, sharp, soft. I want you to close your eyes, tell me which it is and where it's at, okay? Close your eyes.
Start with the foot, right foot.
Okay, very good.
Soft and right arm.
Okay.
Start with left arm. Soft on forehead. Soft on left foot.
Okay, so you successfully were able to sense what object was touching and where. Okay. And next we're going to do another sensation where I'm just going to have you close your eyes